As rural communities in Timor-Leste remain hours away from their nearest hospital, Mission Aviation Fellowship continues to provide a vital lifeline through its air ambulance service. MAF Country Director and Pilot Mr. Lungpinglak Domtta discusses how the organization delivers emergency medical transport and the challenges of operating in remote areas.
Thank you for being with us, Mr. Ping. Mission Aviation is the only provider of an essential air ambulance in the country. How does your work help rural communities to access the medical care they need?
Our air ambulance service helps community by saving times, while you know that in an emergency, time is very critical. So a road transport ambulance of 5 hours, we can bring it down to half an hour, 40 minutes, and so then they can get access to medical care quicker. And I believe that saving those crucial minutes helps them to get better care in the national hospitals.
In what situations are the MAF services offered at no cost to the patient? And how are these services funded?
So MAF runs on a donation from people, and since 2007, since we started our operations here, we have been providing subsidy to the Ministry of Health. So last year we were providing 45% of subsidy, so the Ministry of Health still covers. So when the patient comes back, we don't charge any money to them. The Ministry of Health provides 55%, and then the rest 45% is covered by our organization that we have raised money in the past. And so I would say that directly we don't charge the family members, but there are other projects which I don't know if I will have a time to cover, but we have a project where we facilitate the patients to return back to their home, and that is, we charge them only the cost of a bus fare.
Can you tell us about a recent memorable experience that exemplifies MAF's mission?
So right now there's a family that needs to go back to Okusi, and we are working our best how we can support them. And we evacuated this mother. She is pregnant, and she has been discharged from the hospital. But because we don't fly regularly to Okusi, we have not been able to take them back home. And so last weekend they contacted us, and because since we didn't have flights, we paid them money to go back by boat. And when they went to catch the boat, the conductor said, "You're pregnant and you can't go on a boat." So the next day they tried to go by road, but because they live in a rural place communities, they don't have passports. They were access denied at the border, so they have come back. So now next Monday we are planning to fly this family back home.
What challenges does MAF face in offering these services to rural Timorese patients?
So one, the weather. The weather here is very challenging. Yesterday it was beautiful sunshine in Dili, and no one would imagine that it will be raining in Suai. So one is the weather that limits us from flying out to pick up the patients, and also the mountains around Bobonaro and Same, those areas, the weather can change very quickly. And when a new family comes in, the language are also a challenges because people come, they speak English, and it's hard for us to communicate with the people. And in a time crucial moment, I believe this communication is also very important.
Across the 12 countries in which MAF operates, how has the war in the Middle East impacted your services?
So thankfully, so far, Timor-Leste is one of the only program that has not been affected badly because we were able to get our fuel supply before. But I'm aware that all our MAF programs in other countries, that there has been a significant rise in fuel price, which is directly affecting the customers. And if this continues for a longer run, it might affect us after a few months. But right now, we have not been affected very badly by the Middle East crisis.
How does MAF ensure its services can continue through periods where global fuel supplies are uncertain?
MAF runs on donation, so they are dedicated teams. They are raising supports for us. So that's one of the reasons MAF has been continuing. And if ever there is cases like that where the fuel price goes up, then yes, we will either have to raise more supports to compensate for that, or we will have to strengthen our partnership with Ministry of Health and see how Ministry of Health can also come together, because in the good times, MAF has been able to support whatever we can. And in these scenarios, I believe as government stepping in a little more to cover a little bit of the cost could ensure us to provide the service without disrupting the essential service in Timor.
Thank you for talking to us, Mr. King.
Thank you. Thank you very much. Yeah.